Hello, everyone. Welcome to this webinar on the theme of subject of narcissism. These webinars are brought to you by the International Institute for Bioenergetic Analysis. They are produced by the teaching committee under the able leadership of Patrizia Moselli. I need to take a personal moment before beginning today. As we gather here, many of us, perhaps most of us, part of the community of bioenergetic psychotherapists and others interested in our work, very welcome. I am very occupied with the situation of my colleagues and friends in Israel. I am a member of the Israel Society for Bioenergetic Analysis. I am a faculty member in the formation program that we conduct there. I know that many of my friends and colleagues' children will have been called up to active military service. I know some of them since they were actually children. Some of my friends and colleagues may be called up because of their skills and capacities. The suffering being endured on all sides is unbearable. What supports me in this presentation today is that this material is directly relevant to what is happening in Israel and around the world and in homes, in families, in institutions, in societies and groups. So the study of narcissistic deformations, what I have come to call and others call pathological narcissism, or what nowadays Otto Kernberg and the colleagues around him have come to call malignant narcissism, is central to the understanding. I don't know that there's much to be done, frankly, but it is central to the understanding of much of the destructive behavior that we see in the world. I have decided to conduct this webinar in the same way that I conduct my teaching, learning process in formation groups. So you won't see any slides and you won't see any graphics. I've done that so that I can conduct myself in the way that I normally would, which is to provide an experiential learning environment. That means that we use our own somatopsychic experience to bring home the significance of the material. And it means that I will make an effort to engage you as listeners in an active way, if that's available for you. There will be moments for active experiential learning. Please use them in the way that fits you best. If something comes up that you want to pursue further, you want to know the name of a book or a paper that I mentioned, or some more specific questions or any questions, I'll be available after the presentation at any time, not right away, because I'm going to go back to see patients after. But my contact information is available on both the IIBA website and also the New York Society website, and I'm happy to be in contact with you. Before we can get into the material, we have to deal with what dynamically oriented psychotherapists call countertransference. The term narcissist, which has come into common usage, has a very pejorative meaning. As we get into the heart of the material for today, it will become clear that we are all narcissists in the technical meaning of the term. To be open then to this material, take a moment right here at the start to consider your default, perhaps unconscious or semi-conscious attitudes about narcissism. I'll tell you some of the pejorative, the negative elements that I am familiar with. Overweening self-focus. I am the center. I am everything. Now, in many spiritual traditions, that's a position granted to the supreme authority. So right away, we're on complicated psychological and emotional grounds. Unearned and inflated positive self-regard. These kinds of attributes, or these behaviors, I should say, behaviors, cause people to respond at both ends of the spectrum, idealizing worshipful admiration. We see that in the world all the time now, nowadays especially. And at the other end, with contempt for the person who manifests these qualities. This is not a suitable attitude for psychotherapists. I intend for this presentation to illuminate why it is not suitable, and also perhaps some of the origin of the prejudice. As an aside, not to do specifically with narcissistic functioning, there is considerable research. Here's a place where if you want a citation, you can contact me, that demonstrates that clinicians who refer to the people we treat or counsel by the name of a characteristic, borderlines, neurotics, those clinicians show themselves to be less empathic overall on observational and self-repertorial instruments. So if you're going to use this term clinically, then talk about people with narcissistic deformations or people with narcissistic defenses. I'll come back to this in a moment, a little more on the process of the presentation. The material I am presenting is dense. I intend to present a fairly comprehensive view of narcissistic functions and dynamics from the theoretical and clinical perspective of a bioenergetic therapist. But let's be clear, this is just the first floor of what is a very complex organization. I got stuck here with floor, now I've got building. I meant a matrix. That's better. It's the entry point to a matrix. So the purpose here is not to elaborate the entire matrix, but to create an entry point for you. My suggestion to you is that you orient yourself to the presentation as you would in your therapist persona. Allow the material to enter and touch you. What I know about the pathological transference that accompanies the term narcissist tells me the material is evocative and stimulating. We can come again at another time to focus more narrowly on theoretical and technical elements. For now, let it be an experiential learning. Pay attention to how you respond to this material as much as you pay attention to the material itself. So a definition to orient us. Freud defined narcissism as self-love. Further elaborations through many generations of experience, process, and theory make it clear that that's too broad, too impressionistic a definition. Narcissism is the set of structures and functions that express, develop, maintain, and regulate positive self-regard, not self-love. And the difference is significant. So I'll say that again. Narcissism is the set of structures and functions that express, develop, maintain, and regulate positive self-regard. The operative energy in narcissism is not love, it is respect. Using a bioenergetic understanding of the quantum energies that are emotions, this is my view, emotions are quantum energetic forms. That means each one is unique. They are not interchangeable any more than vitamin D and vitamin C are interchangeable elements. Love and respect are quite different. They are different also experientially, how they are received, felt, and affect the somatopsychic organism. And they are different in how they organize inside of us and in relationship. All development being a function of relationship processes. It's always been interesting to me when I start to talk about this. I remember that I've lived now an entire life, really, with women fighting for respect. My late wife, my current wife, my friends, my stepmother. So I'm quite aware that although I can't see you all, this is weird, there are quite a substantial number of women participating here today, and I feel quite confident when I say that those of you who are women listening to this know quite well the difference between being loved, being respected, and being loved and respected. Self-regard, which is the broad category of narcissistic functions. Self-regard finds its healthiest embodiment in self-esteem, which elevates regarding oneself positively to a structured and organized self-respect. And like every other function, the capacity for loving, the capacity for analysis, the capacity for making love, it originates in a relatively unorganized form, and in response to maturative dynamics in the person and how those are met in the environment, narcissistic functions, like those others, become more complex, more sophisticated, more refined with practice and with life. In this way of looking at it, self-esteem is a mature function of positive self-regard. And it requires, first, the capacity to receive and metabolize certain emotional energies. Remember back to the quantum idea. Love is actually not among them. The energies of appreciation, acknowledgement, idealization, admiration, and the state of being special to another person. So notice what I'm saying. The state of being special to another person is a fundamental developmental experience necessary for the establishment and maintenance of positive self-regard and then self-esteem. You can see the problems coming already in the family, in the world, the competition over who is special, who is at the center. Healthy, mature self-esteem also requires the ability to receive, consider, and metabolize negative information about oneself. Doing so allows for, watch out for the words now, don't get caught. Doing so allows for healthy regret, guilt, and offers the possibility of repair both to the other person who's been offended, hurt, perhaps even harmed, and also to one's own positive self-regard. If suitable amends, if suitable repair, if suitable reparations even are made, then the effect of that isn't only for the injured party, it's also for the injurer. So the injurer, in order to preserve self-esteem, has to have the ego strength to absorb the reflection back of negative information, assess it, evaluate it for its validity, its truthfulness, and then metabolize it. Patient of mine just this morning, confronting just this situation, found that they attributed the negative information to the other person. They are making me feel valueless. But it was clear, knowing each other as we do, to both of us, that it wasn't coming from the other person. The information that was coming from the other person was indeed negative. The feelings of valuelessness belong to my patient. That doesn't mean that other people won't treat you this way. On the contrary, these are normal human experiences. Before we get to that, let's apply a bioenergetic lens and see how these functions of healthy narcissistic functioning and structure are related to what we know about somatopsychic structure. The easiest way I know to move into this part of the material, and here you can begin to pay attention to your own breathing, because narcissistic functions are related to inflation and deflation. In the normal course of breathing, we inspire and we expire. We fill with air and then we expel the air. Although technically we expel the air, create a differential in air pressure, which will then fill our lungs. We can further inspire, pull air in, and that becomes important here because the word inspire in English also has emotional and interpersonal meanings. It conveys a sense of an energy that lifts, opens, and expands us in various ways. Physically, Psychically, oh, I feel good. I feel good about myself. Emotionally and interpersonally. And this is where it gets a little bit tricky, because this is a function in which one person can affect or influence the other. We can be inspired by another. We often are, for good or ill. Depends on what we are being inspired to do or to think or to feel. So in that sense, inspiration includes the power to move people. And this becomes a significant matter when we begin to look at narcissistic functions in a more concrete and direct way. So for now, before we get to that, let me illuminate this in an experiential way. Feel free to join in if it suits you. See if you can sit yourself up. If you wish to stand, you can, but it doesn't matter to me. But sit yourself up as straight, erect as you can. So that means you have to use the muscles in your back to open your shoulders, not to lift them, but to open them. And right away, you see what's happening. Your chest comes up. If you keep your gaze level, and now inflate. And you'll notice that if you can do it, which, by the way, we just did a workshop on breathing in the New York Society. And one of the things that I said in my part was, we tell people to take a deep breath, but we bioenergetic therapists know that characterological structure interferes with or even prohibits taking a deep breath. So if the starting place for your intervention is take a deep breath, and the person really cannot do that, I'll leave it to you to fill in the blank there. But here, experimentally, try it. And I think you'll notice that there's an inflation and then a deflation. And that rhythm of inflation and deflation is central to understanding narcissistic dynamics, structures, functions, defenses from a bioenergetic standpoint. In a facilitating environment in which children are seen, loved, cared for, and then respected, healthy narcissism endows the person with positive self-regard, which will turn into self-respect and then self-esteem. Healthy self-esteem includes the ego strength to absorb negative information about oneself, especially about oneself in relation to others. Evaluate that information, and where needed, feel bad about one's actions. And then take corrective action, thereby restoring self-esteem and the esteem of others. So to review this now from a bioenergetic standpoint, inflation, when it is structured, the person's diaphragm moves flexibly, the muscles of the back, chest, the deep muscles around the viscera, the intercostals, everything holds the spine up, and the child can inflate and then deflate, inflate and deflate rhythmically in a soft and easy way. And in the best circumstance, this upright, inflated state is an experience of pride, the healthy experience of pleasure in oneself. I was careful to say that negative information may stimulate a bad feeling about one's actions, not a chronic bad feeling about oneself. Where there is a momentary deflation, oh, I feel bad about that. Oh, you were hurt. I'm so sorry. That momentary deflation becomes a stimulus. The stimulus can be to activate empathic feelings, or empathic awarenesses is a better way to put it. Empathy is the ability to feel what another person is feeling, even when they're not telling you. And then sympathetic feelings, and that activates a repairing function, both to the other person and then to oneself. It's a stimulus to live up to one's aspirations for, we say in English, uprightness, honorableness, sincerity, truthfulness. Understanding the developmental stages and dynamics using the theoretical concepts of bioenergetic analysis shows the link between narcissistic functions and power. Here's where the countertransference starts to make a clear-eyed view difficult for many of us. The relationship here is between instrumentality, the ability to use oneself to get things done, to be instrumental, the relationship between that and goodness, not feeling good, goodness, benevolence. So the motivation for getting things done becomes critical here, and that is the narcissistic function, the combination of instrumentality, the deployment of power, and the motivation for doing so. As neuromuscular development increases from infancy to toddlerhood, so from birth to about 2 years, as that increase, as the nerve fibers are myelinated and negative feedback loops become established, the capacity for directed action on the part of the child increases. So energy moves from an expanded torso. A loved and loving child has a full torso, and that energy begins to move to the limbs. Ron Robbins taught this 30, 40 now years ago. Wow, I'm really old. And the activation now of instrumental action, the limbs can more and more act in correspondence to need and desire. That is what power is. Power is the capacity to turn that energy force into action. It originates in the solar plexus, in the hara, the Japanese call it, this purse, the center of power in each of us. In Kundalini, it's in the solar plexus. There are many variations of this. Of course, there's also a brain where, as Stanley Kellerman said, we are very cephalophalic. We have this brain at the top of everything, but actually the whole nervous system is a brain. As I said at the beginning, perhaps now we can say more with more specificity. There is a prejudice against the deployment of power. It is threatening. In the 60s, when I came up, power was thought to be intrinsically malignant. In fact, there's a quote from Reich that I saw recently saying exactly that. But power is energy. It has no valence. It is motivation. In the classical psychoanalytic sense that colors the use of power. And I want to be clear here. I'm not talking about authority. Who's in charge? Who gets to say how the bathroom should be cleaned or when the clothes should be put away? That's authority. This is about power. Authority is related to who's in charge. Power is related to who's good. The receiver of the deployment of power is immediately challenged to react to the deployer's intentions, not just to the action, but to the motivation. In healthy narcissistic development, the parents and other authorities around the child have faith in the child's basic goodness. I'll say that again. In healthy narcissistic development, the parents and other authorities around the child have faith in the child's basic goodness. It is faith in the child, respect for her or his right to deploy power that supports this healthy development. It is not love or care. Different energies affect the body very differently, affect the organism very differently. Love, care suffuses, warms, expands in a global way. Power, respect, supports uprightness, supports instrumentality, supports faith in benevolence. Instrumentality takes many forms. Direct action, of course. I want to pick up the glass, pick it up. I'm going to take a drink. This is actually a negative feedback loop. It looks very smooth, but really it's constant correction. Direct action. Induced action. Could you please hand me the glass? Oh, nobody here, so if I could really do induced action, I would summon the power and bring the glass to me without. Never mind, can't do that. Manipulation. Can I find a way to get the environment to do what I need it to do? That's neither good nor bad. That's how I exercise power to get my needs met. The use of objects and selves, mine and others, in the achievement of desired ends. That's all instrumentality, including persuasion and seduction. Already the words start to make people nervous. I know this. So where these instrumental actions are undergirded, where they are carried by motivations of goodness in the context of being able to receive negative information, critical information about oneself and one's actions, to feel bad and to execute repair, self-esteem will eventuate. There's a critical point here brought home to us by Kohut and the theorists of self-psychology, which is that there can be no developed self-structure in the absence of positive self-regard. At a minimum, may not develop into self-esteem, but at a minimum, there has to be some degree of feeling good about oneself as a person in order for a self to develop. There is no organized self-structure without some degree of developed, healthy narcissistic functioning. Where there are failures of faith in the child, or where there are needs to deflate the child and counter the child's instrumentality, or even to destroy positive self-regard, we see deformations in narcissistic function. Deformations. We're all narcissists, one hopes, healthy narcissists. So now let's turn our attention to the deformations. When I teach personality development from a bioenergetic perspective, I offer participants a way to experience the matrix of energy, feeling, consciousness, and attitudes that lead to healthy or unhealthy patterns, enduring patterns. I've just described in brief what happens in an environment that facilitates the development of healthy self-esteem. This is where the parents and the authorities say, look at you, look what you can do. Wow, you are great. And the feeling of inspiration is communicated and supported. And then that supports the positive expansion and underlying neuromuscular fascia structures that hold that in place. Now let's turn to situations where the environment is either deficient in supporting that, and then we'll look even further at where the environment is toxic and destructive to narcissistic functions. Now, this is a laboratory way of looking at these processes. In real life, things are blended, intertwined, complicated, complex, everything's happening at once. And then add to that, that in every individual, they are unique and one of a kind. So we are talking here about chronic relational patterns, not single events. In life, narcissistic injury, feeling wounded by attitudes of disrespect, devaluation, even contempt, are inevitable. In healthy narcissistic functioning, reinflation is possible. Now we're going to look at what happens when there is insufficient support for those restorative functions, or where the capacity for restoration has been destroyed, or in the worst case, where the seeds of positive self-regard are destroyed before they begin to grow. One of the most influential experiences in my life as a patient and as a therapist happened in 1974 when I went to a talk by Otto Kernberg on borderline organization, as he was just beginning to formulate ideas which rested on the ideas of Harold Searles and others who were beginning to really look at that domain of experience. And Kernberg was speaking at a hospital talk, and he said, when you are working with borderline people, it is not useful, nor I would say accurate, to describe them as people with low self-esteem. You have to rather understand them to be people with no self-esteem. The destruction of healthy potential for narcissistic functions. In the deficient condition, where the child's power is unsupported, the child's need to be perceived as special is experienced as a demand and manipulation for centrality. The parent's capacity to allow the child to take the center, to admire and recognize the child's intrinsic worth, is very limited. The child may be loved and cared for, but the demand to be admired, to be looked up to, in bioenergetic terms, to have that whole I'm hearing a translator again, sorry. Okay, just letting you know. See that? As soon as I make the gesture of worship, the God speaks. I've got to be careful around you people. What's going on here? So this gesture, this movement, many years ago, David Campbell, wow, many, many years ago, led a workshop on worship. And the whole gesture of opening oneself to those feelings for another person or another being, if that's what is meaningful for you, is so powerful. But that is, in the deficient state, both exciting and threatening. To look up to the child, to be thrilled by the child's power, is both exciting and threatening. And then there is a mixture in the parents of idealization, fear of the child's power, as if the child makes the parent feel things and do things, and envy. In a Kleinian sense, that envy is critical to the formation of pathological structures in personality. The result is that the parent tells the child that she or he is not so important and should not think they. And this attitude really can be reinforced by social norms as well. There are cultural systems which say, don't stand out, don't think you're so important, and listen to the tone, listen as bioenergetic therapists listen. Well, don't make such a big deal of yourself. Listen to the deflation. The force of the deflation is designed exactly to do that, to generate a massive, and in later we'll see catastrophic deflation. Humiliation, which is the active, energetic, negative force here. It's not hate. Of course, they may hate the child also, but humiliation energetically is a force designed to make a person feel smaller. So don't think so much of yourself. Don't, oh, look, whoa, look at the big boy. All of that is designed for that. Many years ago, I went to a workshop with Dick Olney. He was a contemporary of Al Lowen's, did his own way of working, but used many bioenergetic concepts and perspectives. And he said to me when I wanted to work, I'm one of those people who kind of does that. And he said, okay, stand up. We were in a circle. My late wife was there with me, otherwise I don't know if I could have done this. And he said, now, swing your arms up and say, here I am, here I am. Well, I managed about 7 of those before I burst into tears. He had observed the, I thought, pretty subtle thrust in me, which I didn't even really know about at that time, to make myself known and seen, and the terrible wound that existed in my being in response to that movement. In the toxic condition, the child's power is seen as driven by a malevolent urge to possess and exploit the parents. So now instrumentality, not only not motivated by benevolence, but motivated by a malevolent urge to take possession and use the other person's resources, love, admiration, respect, sexuality, pleasure, for their own purposes. It is from here that the mythology of vampires arises. And just to remember, in that mythology, the vampire cannot generate its own life force and energy, its own power and positive self-regard. It must take those continuously, feed on those from other people so as to have them for her or himself. And they never mature. They never face themselves. They never face mortality. And interestingly, do not see their image in a mirror, which has great significance for the work of psychodynamic psychotherapists. Here, the child is perceived as a manipulative demon, doing anything without principles to satisfy her or his own narcissistic greed, to feel great, to feel powerful, to feel, in Mike Eigen's terms, all-knowing, which in an article he wrote called The Immoral Conscience, he described omniscience, the idea that I know everything, to be perhaps the most dangerous of human characteristics. Significantly, for understanding narcissistic defenses, the predations of severely narcissistically deformed individuals, maybe those who Kernberg would say have malignant narcissism, is not for the purpose of accumulating more power, praise, and admiration. It is to replenish a supply that cannot be metabolized and turned into positive self-regard. The functions of metabolization, identification, metabolization, are destroyed. So the need is insatiable. The attack on the child then is at the level of the diaphragm, and it's an attack intended to create a catastrophic deflation. So you can try it right now. If you get a blow to the solar plexus and you completely collapse, how are you going to reinflate from here? You're going to have to, and if you do that 3 or 4 times, you'll begin to sense that after this happens, the 5 or 6 or 10 million times that it happens to a child, either the child remains in a permanently collapsed position, I'm nothing, I'm nobody, I'm valueless, or the opposite. They remain in an inflated position with no possibility of deflation. The way that the parent cements this into place in interpersonal terms is a direct attack on the child's character. Because remember, what's being said here is you are not good. Perhaps you are evil. I know who you really are. So there's a, I'm sorry for the language, but I don't have better language than this. There's a mind-fucking element. I really know who you are. And you are not the person I thought you were. These are massive attacks on character. And the implication is you are seducing me, manipulating me to do things against my will. you are evil. So anything I do to either take control of you, zombie-like, that's the zombie myth, or to destroy you is perfectly justified. These severe conditions, even the deficient ones are severe and toxic, give rise to defenses. Can't live in the states generated in these deficient and toxic conditions. These defenses are necessary for survival. Many people kill themselves in moments in which the experience of defeat, humiliation, being rendered totally impotent, despised, is more than can be managed. We don't talk much about defeat in general, in the psychotherapeutic literature, in the bioenergetic literature, which is puzzling to me because defeat is among the most difficult, if not most difficult, experiences in life. And it may be impossible to recover from. People with severely deformed narcissistic functions, for people like that, life without defenses is impossible. And the more severe the attack on goodness, value, sincerity, and honorableness, the more restrictive and absolute those defenses must be. The defenses all rest on the need to remain inflated, either against the internal pull of insufficient narcissistic supplies, or against the deflating, crushing effect on goodness, uprightness, and honorableness. Responding to chronic attack and defeat, the defenses become hardened attempts to assert superiority, to control indirectly all that others do and offer. Direct control is much too threatening. And to be at the center of all narcissistic regard, to be feared and worshipped. Much of human spiritual life contains these elements. These defenses then appear in many different forms, influenced by the unique characteristics of the individual's personal, familial, and social endowments and experiences. And they are felt by the individual to be absolutely right. They are responses to victimization, to forced submission and enslavement. And so the actions that are taken are not my responsibility. They are not the doer's responsibility. They are responses to what's been done to one. The totality of psychopathic defenses, that's what we're talking about here, rests on the need to feel and be superior. The attitude of victimization and the entitlement to get what is owed one restitutively. There is an absolute necessity to feel that one is somebody and not a nobody, because the destruction or the limitation of narcissistic functions is to say, you are not important, you are not significant, you are not worthwhile. So those conditions have to be asserted defensively, even when they are compensatory. They are compensatory for the absence of positive self-regard. They are not expressions of self-regard. They are compensatory for the absence of self-regard. In the fight for significance, it must be seen that these defenses represent a fight to gain significance and value in an environment in which the person, child, now adult, had no power to influence others' judgments of her or him, to be seen as valuable. Narcissistic defenses exist in all character organizations, where the predominant pre-Oedipal organization centers on narcissistic dynamics. We refer to the psychopathic organization in bioenergetic analysis. And unfortunately, when I first started in training, there were no schizoid people in the training program, because it was thought that no one with a schizoid organization could be a therapist. Well, we know much better now. It became more bearable. People could say, I'm organized as a schizoid person. I have not yet met anyone willing to say, yes, I'm organized as a psychopathic person. How do you do? I wrote a paper a long time ago renaming this configuration the defensive character. Perhaps I will finally publish that paper. It is central to understand that pathological narcissistic defenses, pathological narcissistic defenses, enable the person to stay suspended over profound humiliation, defeat, shame, and self-loathing, with no positive regard acting as a cushion. The person cannot allow the function of letting down, which most psychotherapists think is a central dynamic of psychotherapeutic practice, to be able to let down. So, working in psychotherapy with these deformations starts with one of the most basic constituent elements of the formation of the psychotherapy environment. That is the challenge to the therapist of maintaining unconditional positive regard for our patients. To be clear, and I hope this is beginning to fall into place conceptually now, this is not about unconditional love. If such a thing exists, I don't know, but it's not about that. It is that the therapist's respect for the uniqueness, the sentience, the human special unique quality, the value of the person is not contingent on what the patient does. You, the patient, have no control or authority over my respect for you as a human being. This is fundamental to the idea of a co-created egalitarian relationship that comes out of feminist psychotherapy theory. All the members of the relationship have equal value, not necessarily equal authority or even necessarily equal power, but equal value. It is inherent in the therapeutic persona, the therapist persona, that the therapist creates. It cannot be won or lost, destroyed or earned. In this way, the patient always has someone who does not denigrate, humiliate, or defeat them. Without this dynamic in place, the psychotherapy cannot proceed. In the most severe cases of the destruction of narcissistic functions in borderline and schizophrenic people, the result is also the failure to develop a self-conscious self. The experience of being possessed, merged with, and merging with, or in the case of schizophrenic people, fusing with another person to get some relief from the unbearable feelings of lack of value, become part of an interior life that is also, in addition to these deformations and destructive elements, a life shot through with terror, rage, despair, and more, and with only very brittle and primitive defenses to continue living. These states, these early primitive states, and organizations and conditions are very challenging to work with. Severe pathological narcissism is always a part of that picture. But that really requires a separate conversation. When Freud says schizophrenia is fundamentally a narcissistic disorder, he's talking about to my knowledge, both personally, experientially, and professionally, he's talking about the necessity of creating an alternative version of oneself, separate from the deep interior version of oneself, which can behave with some measure of inflation. I wrote a paper once, not a paper, really an essay called Living the Two-Person Identity, which is on this theme. And that because the universe of people with borderline, schizophrenic, and I don't know, I haven't read the book yet, I've seen a little bit of it, this malignant narcissism that Kernberg is opening the way towards studying. This exists in a separate universe, in a different universe with different emotional and psychic physics from people in a more character disordered reality, and certainly from neurotic people. But in all of these terribly painful, life-defeating, life-limiting, self-defeating existences, there are narcissistic defenses because there's been an attack at some level, in some way, on the child's embodiment, expression of power and its instrumentalization, making it instrumental. Even where the wounds and defenses are more circumscribed, they're more contained, the challenge to the therapist is substantial. And the danger of countertransference acting out is ever present. Who is the good one? Who is the honorable one? Who is really sincere? Who really does the right thing? Who really has principles? How much challenge to sincerity, to goodness, to honorableness can the therapist tolerate? That's what I have to say to you about narcissism today. Right under the time limit.
Sure, Scott, thank you very much. And I'll tell you immediately 2 questions that we have. Yes, the first one is this. At the beginning of a therapeutic process, the therapist, what has to take in account for when the therapist meet a person with a narcissistic disturb of personality?
So I don't know who wrote this, and please don't be insulted.
Do you want to know the name?
No, not at all. It's a great question. It's a very important question, but it's a countertransference question because it comes out of what does the therapist need to do to be able to control the situation? Because otherwise, the answer to the question is you take the person in as they are. But here I can feel, and I know it in myself, certainly, I have to be careful here. This person is trying to maneuver me. They are trying to get underneath my defenses. They are trying to get me to feel all these gestures and movements. So be aware of that. But what I would say more importantly is we design the therapeutic environment to protect us from harm. So when I enter that environment, like Baum says, without desire, without expectation. You want to try to move me around and twist me around? I will only allow it up to the point where I am threatened with harm. Otherwise, my late wife, who worked on an inpatient psychiatric unit, as I did, would often talk about, she did a lot of teaching in the unit. She worked with inpatient adolescents. And she would often talk to the staff about their anxiety and their resentment of being manipulated. And she would say, if these children didn't have to manipulate to get their needs met, they wouldn't be here. So I would say to the person asking the question, the starting place for the answer. It's a really, really important consultation, supervision kind of question. The starting place is in your own body, mind, security, that nobody makes you do anything you don't want to do. The environment is yours, and you will stop any harm from developing. So, like with all other characterological defenses, can we, I include myself in your question, can we allow the person to be a patient, to live out this process, which is so threatening and so challenging? Dick Olney called this character the challenging character. And sure, you want to register that, and you want to be able to respond to it as a psychotherapist would, without an agenda.
Rosaria,
Sì?
allora tu mi senti perché stai sul canale italiano, dovresti metterti su quello inglese se leggi le domande in inglese.
Sì, aspetta. Però spero che non sia come prima, che si sentiva tutt'altro. Ok. Thank you, Scott. This is another question from the same person. And the question is not, if I understand, for a therapist, but for everybody. And the question is, in the daily life, for example, in family or at work or in a group, how can we help a narcissistic person?
Well, I don't have a... Can you respect someone who treats you with disrespect? Many years ago, my son got into some trouble with us, his mother and me, and we faced it together. And then my wife and I, to get some help with dealing with it, we went to a family therapist, just the two of us, someone who friends of ours, colleagues, knew. And that person taught me something very important. Actually, taught me two very important things, the therapist. One, he said, what's the message to a young person if you do not hold them accountable for their behavior? The message is, I don't have enough respect for you to tell you how upset I am and what I think you did wrong. I don't have enough respect for you. That was profound. It's profound. The other thing, which I already knew, but I got another strong dose of, was how profoundly competitive and envious I am, because how did he know that and I didn't know it? So the relevance of that is, for sure, whatever my son was dealing with, it had also to do with my profound narcissistic deformations. So, like in the old days, you want to help someone with narcissistic deformations, it's a good idea to start with knowing something about your own, and then see if you can provide that other person with an honorable respect and positive regard that isn't contaminated by your own needs for power or superiority or to be the only good one in the room.
Scott, thank you. There is another question for about parents. What can be suggested to a parent who has a son or a daughter, teenager, with the problem of narcissism? What to do to make less deep his or her wound?
Well, if the wound is already there, then repair work has to be done. The development of healthy narcissism is among the most challenging aspects of the human condition. To make room, each of us, for the specialness and the powerfulness of others. Just look at the world. Your question is about the family. The family is the microcosm of the macro environment of the world. This is a worldwide problem. The projective identification, my God is the bigger, better, more special, more powerful God than your God, is a solution to the basic narcissistic challenge of being mortal and weak in a body that little bugs can kill. So how are we going to support each other and our children to be healthily positive regarding, to be able to manage their own competitive feelings and our competitive feelings, to be able to maintain self-respect, to sustain narcissistic wounds? This is the work of our survival. I don't know if we can do it. So I think on an individual level, I work with families, I work with couples, I work with groups, individual patients. On an individual level, things can be done, but in a general sense, it's not part of our orientation to our fellow human beings.
Thank you, Scott. There is a colleague that tells that doesn't agree very much with your statement that every structure stabilizes through narcissistic defenses, and ask you to tell something more to convince him. Can you do it?
I don't know what, I'm sorry, I don't understand the reference. Stabilizes?
Yes, I read directly the sentence of the question, and is, I quarrel with your statement that every structure stabilizes through narcissistic defenses.
Oh, maybe that's a language problem, I'm sorry. I would not say stabilizes. I would say that people who are primarily organized even as neurotic structures, meaning there's a well-organized self with a sense of ongoingness, continuity, and there's a capacity for instrumentality and agency and even autonomy. Even there, we find narcissistic defenses. In the classic idea of a phallic narcissistic structure, those narcissistic defenses are central to the person's neurotic organization. And all I meant by what I said was neurotic deformations and narcissistic deformations exist together. They're not separate. It is not only in psychopathic characters or in narcissistic character disorders that we find these defenses. They are in everyone. There are healthy narcissistic defenses because we come under attack sometimes by people who really want to deflate us for their own purposes. One of the most difficult dynamics of psychotherapy is to resist, to repudiate, to push away the prejudices that have been deployed against oneself as a child. And we know how difficult it is to soften and dissolve prejudice. And yet we talk about dissolving transference, but it's extremely difficult. So knowing something about narcissistic defenses and how they are organized in all character structures, in all of us, is another tool of understanding how the person is organized and how to relate to them. So I see a comment, I'm going to take it up because for many years I worked in youth athletics, and in the everyday world of youth athletics, there was, for me, a lot of emphasis on supporting the children's self-esteem. That did not mean not telling them when they made a mistake. And I've had experiences where children have come to me because they could either see or hear in my voice or hear something I said that I was disappointed. I wasn't disappointed in their play. I was disappointed because they didn't play or they didn't treat their teammates well. So endowing a child with specialness is an intrinsic feeling of their value. It's not about achievement. It's not about accomplishment. It's about how you feel about them. Not about them at all, actually. It's actually about how you feel. I don't know how you can give too much of that to a child. It's your feelings. Where you try to compensate for the absence of your respect, admiration, appreciation, adoration of your child by telling them how wonderful they are, that's bewildering to the child. And it creates a very subtle, hidden power struggle between the child and the parent that then perpetuates into life later on.
Thank you, Scott. Another question is this. With whom a person with narcissistic defenses, with whom these narcissistic persons open a love story, a love affair.
You know, people with narcissistic deformations can be really exciting and really desirable and really appealing. However, if they have no conscience about it, if they have no observing ego about their narcissistic deformations, then they're very dangerous. So at one end of the spectrum, there are people who attach themselves. So attachment, very popular term nowadays, attachment is a doorway to dependency. It's not dependency itself, it's the portal, it's the way the person connects. And there are people who attach so that their narcissistic emptiness is associated to the person who appears to them to be completely inflated, above everything, undefeatable. This is my theory about some of the connection to Donald Trump. I've been watching him for many years. He's in my neighborhood, you know, here in New York. And he's a very complex character. He looks like he's all inflated and it's all clown, but it is not. And I've been trying to understand people's attachment to people like him, to people like Mussolini, to people like Stalin, to people like Putin, to people like Erdogan. It's everywhere in the world, to people like Netanyahu. There's a longing to be able to affiliate with a person whose narcissistic inflation seems undeflatable. So that's what you get sometimes, is the person who attaches like almost like a, not almost like a parasite, and derives a breath, an expansion from that. And then at the other end, you get someone who's just like that person, and they spend their romantic lives together in a power struggle, which is gratifying to both of them.
Thank you. Another question: how do you feel yourself in your counter-transference when a narcissistic structured person comes to you? And how do you react when it's too much for you to endure?
Yeah, well, like I said, it's a challenge. And I can certainly be activated and be the one who has to assert my superiority. And when that happens, if I'm lucky, it's an enactment, meaning I'm living out something of what the patient is going through, and now we're living it together. And if I know that, I can step back and talk to them about what's going on. The only real protection that any of us have is the therapist persona we create, that we then embody in the space in which I give up the center always to the patient. And as long as the patient pays for my time, they have satisfied all their obligation to me. And then I have to be able to tolerate the attack in my own personal work as a patient. Mike Eigen, who's been my therapist for many years, wrote in one of his papers about including some of the work that we do, that he could feel how he was being ground down to nothing. I didn't even experience that. Now I'm beginning is an understatement. I know quite a lot about how I do that. And his way is to remain in his therapist persona and absorb that. I think Otto Kernberg would say, interpret it. Interpret the negativity, interpret the hostility, create a container. I don't know, I was never in consultation with him, but that's my guess. So how each of us does it is very much the art of the work that we do. But when that moves into countertransference acting out, when I have to deflate the patient, when I have to say, I know what's right, I am right, I am superior, I know what's good, I've lost my position. The only solution then is to go have a consultation and decide whether you can actually work with this person. It does them no good if you can't actually work with them. So I'm going to stop there. I can see it's almost to the end. I want to thank the translators. I know I can't see you, but I know what a job this is. And thank you so much, Rosaria. It's always a pleasure to be with you. Thank you. And thank you all for coming and listening. And I look forward to continuing this discussion about this work and how it affects us. Come to the conference in 2025. We will certainly be talking about this. Thank you all so much. Thank you. Bye for now.
Okay. I had some more questions, a lot of other questions. And I think we have 6 minutes.
Rosaria, we can close the webinar.
Ok.
It's better.
Ok. Vuoi prendere tu la parola? No, ringrazio un attimo io. Scott, first of all, thank you very much for your work, for your presentation, and and for the answers, because it's not easy to change the argument, and I think I'll try to send you the other ones, questions. So if you want, you could answer our colleagues.
Anytime. Thank you.
It's okay for you. Well, I leave Marco to finish our network.
Okay, thank you, Scott, and thanks everybody, and see you on 7 November. It's right, Rosaria?
Yes, I think so.
With Robert Kaufman.
Yes,
the next webinar.
He's great. You should not miss him. He's wonderful.
Good.
Thank you. Mark.
Good evening, and thank you, Rosaria, and thank you, Scott. Goodbye.
Okay. Bye.